Hello.
Hi, this is Marquita.
Yes.
Hi, Marquita. This is Dana calling from Ringfeld Dermatology. How are you?
Hi, I'm good, thank you.
Good. Are you able to talk? Are you busy or are you good?
No, I'm fine.
Okay, great. So I'm just looking at your picture here of your tattoo. I just want to make sure that I have the right one. It's like behind your ear, a little part. Okay, perfect. And this is, you said 16 years old?
Yes.
Okay. And where was this tattoo done in the United States?
Yes.
And was it done by a professional?
Yes.
Okay, great. And do you feel like it's faded over time at all?
Not much. Not much that I could tell. I mean, I can tell because I look at it, but not a lot.
Yeah. And then if you like rub your finger over it, does it feel smooth or is it raised a tiny bit at all?
It still feels smooth.
Smooth. Okay. All right. So how familiar are you with tattoo removal process at all, or?
Yeah, not much. I mean, I've known a few people that had their tattoos removed. Some had really good results and it didn't take long. Some said that didn't really have good results. It didn't remove the tattoo entirely, and they had scarring. So I don't know.
Right. So, and that's the tricky thing with tattoo removal is that there's so many different factors in play that, there's not really a good estimate of what is going to happen at the end of the day. We can only use what, our experience of what we know and what we've seen as far as what's going to happen with the tattoo. So we have a laser here called the PicoSure, and the PicoSure basically uses pressure rather than heat in order to break down the tattoo. So at any time you're trying to get rid of a tattoo, if you think of the tattoo as a block of ink in your skin, the goal is to kind of chip away at that block of ink to make the particles of the ink a lot smaller, and then therefore your body will take those little particles and kind of get rid of them just like it would any other toxin in your body. Does that make sense?
Okay. Yes.
So most of the old, in the first lasers that came out, the way that they do that is through heat. So they put like an intense amount of heat into the tattoo, and then that breaks down that block of ink, and then your body takes the ink and get rid of it. What our laser does is it uses, like I said, it uses pressure rather than heat. So the pressure is being delivered at an extremely fast pace, and that it creates almost like a heat-like sensation in order to kind of pulverize that block of ink. So the reason why we believe the PicoSure is better and why we have it here versus the other lasers out there is because of that reason, because it uses the pressure rather than heat, and it can really make much smaller particles, so that way when your body has to absorb those particles, it's a lot easier to absorb and get rid of. Just like it would be easier to kind of like digest a smaller piece of food versus a bigger piece of food. Does that make sense?
Right.
Yeah.
Okay.
Now, when we're talking about your skin tone, the PicoSure is typically approved for people. There's something called a Fitzpatrick scale, and it goes from 1 through 6. So you would probably fall about a 5 on that scale. It depends on the color of your skin and your ethnicity and everything. So technically, the PicoSure is approved for skin types 1 through 4. However, we treat plenty of 5s and 6 and your skin tone all the time. However, a lot of times what can happen is there will be a temporary hyper or hypopigmentation where we've treated the skin could be temporary, a little bit lighter or a little bit darker in the treatment area. So I always like to kind of preface that with saying that just so that way you know that is a possibility during the treatment process. And usually with your skin type, what we would like to do is almost do like a tiny spot treatment to make sure that your skin will respond okay to the laser before we go ahead and treat the whole thing. Now, I don't know if you're up for that spot test just because it is in a visible area, you know what I mean? And if you decide you don't want to get the tattoo removed at the end of the day, then you will probably do something to the ink, So, but we do prefer to do that, usually with your skin tone and the tattoo removal process.
Okay.
We don't charge for like the spot test or anything. It's just for us to make sure before we proceed and treat the whole area that it's a really small little area that we'll treat, that, your skin responds okay, and that if it does either hyper or hypopigment, that the pigment comes back just the way that it should.
Okay.
Okay.
And how much are the treatments?
Yeah, so for something like this, it would basically be like $190 per treatment.
Okay.
And then what we do is if you know, and I'll kind of give you an estimate of how many treatments I think it would be too. We usually say it starts around like 6 to 8 treatments. Like, that's where it would start. Yeah, I mean, it is a process, unfortunately. And someone telling you they can get rid of it sooner than that, I don't know if I would necessarily believe them.
I'm doing the laser armpit hair removal with Renee right now.
Okay.
That's like 6 to 8.
Right.
So I'm muddle through that.
Yeah, I hear you. So what we do is we, if you prepay for 4 treatments, then we give a 20% discount up front. So I think it would be like, I think it's like 608 or something like that. I don't know if I exactly. And then that would bring it down to 152 per treatment versus 190 per treatment. I don't know if I yeah, it would be 608 that you would prepay up front. Now, the other thing is that how many treatments, like I said, it would kind of start at that many treatments. It could be more than that. It could be less than that. We just don't know until we start to see that ink break down. It looks like the tattoo has faded to me over time. I mean, from this picture, it's not a very clear picture, but it doesn't look super dense to me.
Okay.
You know, but you do have that red in there, which is usually the hardest thing to get rid of. So, you know, it's probably going to be more than that. And what we usually tell people is to wait almost like 3 months in between. So it's a long process. It's not going to be gone in a year, okay? And I like to kind of, again, give you, because people think, oh, yeah, even with the laser hair removal, it's like, okay, every 6 weeks. This is a little bit longer than that, and
that's
you're getting a lot of treatment.
3 months?
Yeah. And the reason why we say that, I mean, you could technically come back every 6 weeks for this laser, but especially with your skin tone and the area that you're getting it done is a very sensitive area. There's not a lot of flesh there that can, like, take a very aggressive treatment.
Okay.
So what we're seeing is the longer people wait in between, the better results they're actually getting, because your body is still breaking down that ink. The ink is broken into so many small little particles that your body takes a little bit to break it down. So, you know, when like, for instance, we've had a handful of clients that have, like, had one treatment on a tattoo, and they've gone away to school or blah, 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 and whatever the case may be, they haven't come back for, like, 6 to 12 months. And they only have one treatment. They come back, it looks like they've had a full series of treatments. So your body continues to break that down. So especially if price is an issue, I have no problem with you waiting as long as you want in between treatments, because you should still continue to see results as the treatments progress. I mean, as the time goes on. So that's just something to keep you know, in mind as well. But it is somewhat of a process.
Okay.
Okay. Go ahead.
I mean, that's fine. Yeah, that's fine.
Yeah. As far as the treatment itself, how does it feel? It kind of feels like tiny little snaps on the skin. You have the laser hair removal, so, you know, it's not...
It can't be worse than that.
And it's super quick. I mean, I could literally treat this tattoo in less than a minute. It would be, like, so quick. We don't use numbing cream, but we do use a really cold freezing air to kind of numb up the area beforehand, and then we have that going during the treatment as well. Afterwards, it kind of heals and feels like when you get a tattoo, so you can get some blisters, you know, crusting, scabbing, swelling, bleeding, all that kind of stuff. We just ask you to keep it covered, keep it clean, make sure it doesn't get infected. You know, we'll go over everything with you when you do decide to get the treatment done. But, yeah, it's not too traumatic, but it's not a fun time.
Okay.
Yeah.
Well, I'll start, and then I guess I'll go ahead and pay for the 4 up front.
Yeah, and that doesn't expire or anything, so you don't have to use it in a certain amount of time. And the other thing is, I mean, best case scenario, you only need 3 treatments, right? And then if you do prepay for the 4, then we basically just charge you the full price for those 3 treatments and refund you whatever is left over.
Okay.
Now, at the end of the day, what is your tattoo going to look like? Like you said, you have a couple friends that have had different experiences. So I usually say there's kind of 3 different options of what would happen. Best case scenario is that it looks like you never had a tattoo there ever to begin with. That's what we're hoping for. You know, second case scenario would be something that we call ghost tattoo, where where your tattoo was is like a slight shade lighter than your original skin tone, like where it just looks like the ghost of the tattoo is remaining almost. And then the third option is there's certain areas maybe where the tattoo artist like put more ink in or put the needle in a little bit deeper, something like that, where there's still like almost like a tiny bit of a shadow of the ink left over. Now, with those second two options, usually over time your body kind of either eats up the ink or the skin evens out. So, again, time is going to be your friend in this whole entire, process, that we're going to see it, kind of even out over time. It's usually a combination of all three of those things, where some areas look like nothing was ever there, some areas are a tiny bit lighter, some areas have like a shadow of the tattoo. And then especially with something little like this, we usually, we get some nice results from it.
Yeah, because I think this is like a nickel size or something like that.
Yeah, it's hard for me to see like how many treatments you would need or whatever, but just from seeing the area and what it is and all that kind of stuff, it looks like, somewhat easy to remove, especially because it's older too, but, we never know. We never know until we kind of go in there and have a better idea.
Okay.
Unfortunately.
Oh, no, that's fine. And I actually don't know anyone with my skin tone.
Right.
Who's gotten removed. They've all been a lot lighter. So
right. And with the PicoSure, it's actually a lot less prone to scarring because we're not using that heat. That's usually what happens is there's too much heat that is created, and then it can create like a scar. Are you prone to getting keloids or raised scars at all?
No, not really.
Okay. Yeah, so I mean, very rarely do we see that happen with the PicoSure. As a matter of fact, a lot of times we almost like treat, we have like a lot of people that get the other type of laser, and then we treat it with the PicoSure, and it seems to get better. So we don't anticipate that happening, but it is always a possibility of some scarring too, or like kind of some scar tissue being built up.
Okay. I'll try it. Hopefully I won't get the scar tissue.
Yeah, I mean, and again, that's another reason why we do the, 1 second.
Jay, let's see.
What was I going to say? I'm sorry, I lost my train of thought. As far as the scar, what was that? I'm sorry, Marquita, what was I saying?
The scar tissue, I was just saying, hopefully,
yeah, that's another reason why we do the spot test, to make sure that your skin responds okay and everything like that. And, especially we've been doing this a long time with this laser, so in that area, like I said, we can't be too aggressive because that's when the scar tissue is going to form, when there's too much something happening there, you know what I mean, and then your body kind of doesn't respond well. So as long as we know what we're doing, and if you're not prone to getting those types of scars, like I said, it's very rare that we see that happen with the PicoSure.
Okay.
Okay. Did you want to make your first appointment, or do you want to wait?
I'll go ahead and make my first appointment.
Okay. That's great. I am going, and you don't have to decide now, like I said, if you want to do the prepay for 4, or if you want to just pay as you go, that's totally up to you. You can decide that when you come in for your appointment, okay?
Okay.
Okay. I'm going to put you on hold and have someone schedule you, okay, Marquita?
Okay.
All right. Thanks. And my name's Tina, so if you have any questions, then just give me a call back in the meantime.
Okay.
And
all right. Thank you.
Real quick, there's no chance that you're breastfeeding or pregnant, right?
Not a chance. Not a snowball chance in hell.
Have to ask. That's like the main contraindication. The other thing is we just want to make sure that you're really careful in the sun too. Okay, in that area.
Yeah.
Okay. Yeah. All right. I'm going to put you on hold and they'll schedule you. Okay.
Okay.
Thank you.
Jana.
Yeah.
One question: when I make the appointment, do I tell them that am I making the appointment right now for the spot treatment or for the?
Yeah, we're going to start out with the spot test first, and then we can proceed from there.